I'm Dr. Gregory James Hummer. I'm a trained trauma surgeon and the CEO of Simplicity Health Plans. We're in a big mess in the United States today as it pertains to healthcare, in particularly health insurance. And this short series of videos will help you understand how we got to that situation. 4 factors account for 70% of the chronic disease in the United States: high blood pressure, cholesterol, overweight, smoking. 8 out of 10 Americans today are relatively healthy and will spend no more than $700 to $800 in a year, and that includes families, which means the other 2 out of 10 spend most of all the resources that we have available. Currently, our healthcare expenditures are well over $2.2 trillion. This video will consist of 3 main components. The first will be the history of healthcare and how we got into this mess. The second will pertain to how to fix it. And the third will be information about Simplicity Health Plans and how we can offer a solution to the problem. Thank you for watching the videos, and I hope you enjoy them.
The United States was never founded on the principle that someone else is entitled to your money simply because you are more successful, nor is anyone entitled to what you possess simply because they want it. Our forefathers recognized that everyone deserved a chance for the American dream, but a major change occurred in American politics from the 1960s to the 1990s that made many people feel they were entitled to the benefits of the American dream, just because they were American citizens, or worse, because they lived on American soil, even though they were not U.S. citizens. This truth may be difficult to swallow, because Americans are so generous with their time, talent, and money. But this sense of entitlement has become so rooted in our way of life that it affects the amount of money you have to pay for health insurance premiums. In a sense, government-sponsored free health care is an unseen tax on those who work and prosper their lives. This tax manifests itself not only in your health insurance premiums, but in the cost of things you buy with your own hard-earned money. Why? Because no provider can give away free health care. Somebody has to pay for it. If a hospital or doctor cannot collect their just due, they have to apportion the loss amongst those who do pay. We all know that health insurance premiums have skyrocketed. At this point in time, some American companies literally spend more on health care for their employees than they do on the raw materials for their products. That is not a joke. As a nation, by the year 2007, combining all health care expenditures, U.S. citizens collectively spent over $5,700 per person for health care. Did you spend that much last year? Probably not. That's an astronomical figure for the vast majority of Americans. The average American individual and family today spends less than $700 per year on their health care. That means that someone is spending a lot more on their health care than the average person or family. By the year 2005, total health care expenditures reached $2.3 trillion, and the government projects that these same expenditures will rise to over $14 trillion by the year 2017. There are many factors that contribute to this total cost, but 4 things affect the total cost of health care more than anything else. First, the cost of our health care insurance policies has increased substantially because service companies have added layer upon layer of their profits to the actual cost of your health care. Second, with the advances and availability of new medical technologies, the cost of sophisticated treatments has skyrocketed. Third, the cost of government tax-funded health services to the elderly, poor, the indigent, and to legal and illegal aliens has spread the cost burden to us all as a hidden tax. And fourth, the effects of pooling healthy people with unhealthy people affects the health care cost for everyone. Let's examine each factor in more detail.
Thank you for watching this segment. Be sure to tune in to the next clip.